Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Vijay, with you. And I came up today in this. Currently, I'm doing in train. And please bear with us. And regarding the e-participation certificate, we are trying to get it back through as soon as possible. I hope it comes up within November. I'm trying my best and just asking for few more times. So without wasting, we have wasted actually 14 minutes. So without wasting any more time, let's just jump into 30 seconds countdown time.
Hello. Good evening,
Good
everyone.
evening.
Good evening,
Good
sir.
evening to all of you. Good evening. Very good evening.
Welcome, everyone. And NIH Alumni Association has reached another milestone today. So today is our 125th CME, that is Continuous Medical Association Education, with all the efforts of our president, Dr. Narayan Kalyani sir, and our secretary of the association, Dr. Vidyut Mukherjee sir. We have reached this milestone, and today is a special episode where we will be having clinical cases discussed by different alumni of our NIH. So I heartily welcome you all to today's session. So we can call our inaugurator, if with your permission.
Sure, please call.
So today's inaugurator is none other than our Secretary Sir, Dr. Vidyut Mukherjee Sir. And I would like to really congratulate and appreciate his efforts because he is traveling, he is in train, and still he is doing this session with us. So welcome, sir. Good evening. Dr. Arka, if you can please add, sir.
Most dynamic person among all of us. In train,
Sure,
in
sir.
bus, nothing is constant for him.
Yeah, we all should learn from him. Like the show must
Definitely,
go on, sir.
always.
Anyhow.
24 hours ready.
Dr. Arka?
Probably there is some network issue. Let us wait for a few seconds.
So we had similar session, which was our 99th CME earlier. And today, something similar we will be doing, where different doctors will be sharing their clinical insights with us. So I hope you all are very excited to hear from all their experiences.
No.
Good evening, sir.
Good evening, everybody.
Welcome.
We are facing a lot of challenges since day one, and homeopathy and
See, homeopathy is a system of medicine which
Please bear with us. We are facing network issues at train. If possible, I just ask. I'm asking Enadi to just continue, as I'm facing network issues. So please continue.
No worries, no worries. As we all know that sir is traveling, and as I already told you, we appreciate that sir you are taking all the efforts in spite of your busy schedule. You're traveling, and still you managed to join. That is most important. And yes, because of network issues, so we all understand that. Sir will join whenever he will be able to when he gets some good network. Till then, we can start with the session with your permission, sir.
sure, please start.
Okay, so first we have Dr. Soumyanath Mallik, who will be sharing his case, alumni of NIH. If we could just add him, Dr. Alka. We are already running late actually, so we'll not waste much time and we'll give more time to the speakers so that they can complete their
Sure,
cases in time.
definitely.
So let's welcome Dr. Soumyanath Mallik.
Hello. Good evening, sir.
Good evening.
Good evening. Good evening, Dr. Hinadi, and good evening, esteemed members. Good evening, esteemed members of the NIH Alumni Association. I, Dr. Soumyanath Mallik, 29th batch PHMS, and it's really I'm feeling really very nostalgic that to be a part of this to present my clinical case in this conclave. So emotions are running high in me that once I was a student and now I am going as an alumni to present my case here. So can you, so here I am going with the case. So my case is, my case is role of homeopathic intervention in the management of the gallbladder polyp with grade 2 isolated systolic hypertension and evidence-based case report. So for acknowledgement, I, Dr. Soumyanath Mallik, pay my respectful homage to the omnipotent Almighty. I pay my revered tributes to Dr. Samuel Masters Dr. Samuel Hahnemann, I pay the opportunity to thank our very own director, Dr. Pralay Sharma sir, Director, National Institute of Homeopathy, Kolkata, Dr. Vidyut Mukherjee sir, General Secretary, NIH Alumni Association, and Dr. Narayan Kalyani sir, President, NIH Association. It's in fact really a matter of fortune and deep honor for me as an alumnus of NIH to present a successfully treated case of mine, which I cured at the premises of NIH OPD during my internship tenure. And lastly, I paid my heartfelt thanks to the patients of the OPD of NIH for providing the necessary relevant information for preparing this case study. So, gallbladder polyp. Gallbladder polyps are actually the polypoid lesions of the gallbladder, generally found in USG, approximately 3% to 6% in a general population. Mostly affected individuals really remain symptomatic, generally detected by USG. A gallbladder polyp can be defined as a mucosal surface elevation that protrudes into the gallbladder lumen, and it can not produce any posterior acoustic shading on transabdominal ultrasound. So classification of the and clinical overview. Classification: generally true polyps and pseudo polyps are there. Among these, the pseudo polyps are most common, generally detected, usually benign. True polyps generally have the malignant potential. Size and prevalence: mean size is generally 4 mm. Only 5% have been seen as per the studies greater than 10 mm. Mostly common in middle-aged individuals. Polyp less than 10 mm are rarely malignant, but polyps greater than 10 mm are highly malignant potential. So surgery advised generally for the age greater than 50 years and polyp greater than 10 mm with or without cholelithiasis. As you can see in the picture, these are the different types of polyps that can appear: single large gallbladder polyp, multiple gallbladder polyp. Like this, the figures are given in the left-hand side. So signs and symptoms of gallbladder polyp generally remains asymptomatic, but still the patient may face indigestion, vomiting and nausea, pain in the upper abdomen, right upper abdomen, etc. But in case of recent studies, new studies challenge the existing surgical guidelines. A Dutch study has been done with a sample size of 156 participants, which suggests that USG tends to overestimate size, leading to the overtreatment of non-neoplastic polyps. So, patients are, as day and day are progressing, patients are generally opting for alternative modes of treatment like homeopathy and Ayurveda. However, this documented evidence of successful non-surgical managements are very limited. Few published case reports are there of positive outcomes with homeopathic intervention. So I'm directly going to my case report. So present complaint: a 20 years old female attended the OPD of NIH on July 23 with cutting pain in the right hypochondriac region for the last 4 months occasionally. She had other complaints like headache, dyspepsia, heartburn, flatulence. History: before reporting to NIH, she went to a nearby hospital for treatment and she was advised for USG. The USG report revealed multiple gallbladder polyps. She was advised allopathic treatment like analgesics and to drink plenty of water. However, they also referred to the surgery department, and in surgery department, she was advised for surgical removal of these gallbladder polyps. But the patient has immense faith on homeopathy, and she came to NIH, and she decided to opt for homeopathic treatment to avoid surgery. She has past history of UTI about 5 years ago, which troubled her for 7 months. She has done this treatment with nearby local allopathic doctor with conventional medicines. On family history, we have found that the father has complaints of hypertension and mother has history of uterine fibroid. Personal history: she is actual ITI profession, naturally, which leads to a very stressful work environment, and she had to face frequent night shifts. And as a result, her irregular diet habits have become a common manifestation of her. Okay, so since she was a patient of hypertension, she was regularly taking antihypertensive medicines. So on physical generals inquiry, we find out that her appetite is very good. She has desire for fatty, spicy foods and sweets. She drinks 3 to 4 liters per day. Her stool is very irregular, ineffectual, with much flatulence. Menstrual history: her irregular cycles are there with clots present during the flow. Thermally, she is a hot patient, and we found out her sleep is disturbed. Mentally, she likes to alone. She has excellent good memory and clear understanding. But one thing which troubled her is the tremendous anxiety regarding her financial matters and regarding her health. She is as well as fastidious as well as ardent in nature, and she gets easily angry on slightest cause. On general examination, her height was found to be 5 feet 1 inch, weight 67 kg, pulse 86 beats per minute, and blood pressure 164 by 88, which refers grade 2 systolic hypertension. On abdominal examination, that is in palpation at OPD, we found there was a mild tenderness at the right upper quadrant of the abdomen without any rigidity or muscle guard. So, based on the UST report and the palpitation UST report on 17 June 23, so we are already suggesting multiple gallbladder polyps, and as well as on our clinical studies of palpation, we found out that it's a confirmed case of multiple gallbladder polyp with grade 2 isolated systolic hypertension. The ICD code as per 11 as per is DC 10.3. So analysis has an evolution of the symptoms we have taken as per the Kantian philosophy and Kantian method, where mental generals are the primary one, followed by the physical ones and the particular ones. So in mental generals, we find out she had anxiety about her health and financial condition. She is fastidious in nature, ardent in nature. Physical generals, she has extreme desire for fatty foods and sweet. She drinks has profuse thirst, drinks 3 to 4 liters per day, mostly in the morning. Irregular, ineffectual bowel movement with flatulence, disturbed sleep, irregular menses with clotted flow. And particular symptoms, cutting pain in the right hypochondriacal region for the last 4 months occasionally. Miasmatic. The miasmatic multimas is generally the miasms has been down best as per the JH and H.A. Roberts. And on miasmatic analysis, it has 11 symptoms have been taken, and in this it has been found that the sodic predominance is found with 6 score, whereas the psychosis is 4 and syphilis is 1. So it's generally a multi-miasmatic background with the predominance of sodic trait. Reportation has been done based on the Kent's repertory, and I used Homepath Firefly software to converting the characteristic symptoms into rubrics. On screen, you can see these are the following 10 rubrics given, as well as the medicines given as per their chronological order. So after careful repertoration, Nux vomica we found is covering all the 10 symptoms with a total score of 18. So based on the totality of the symptoms, miasmatic evaluation and corroboration from different materia medica like alin, puric, Herring's guiding symptom, Nux vomica in 50 millisimal potency was seen to be the most appropriate simulinum for this case. So the first prescription on 10th July 2023, the patient was prescribed Nux vomica 0/1 followed by 0/2, divided into 16 equal doses. It is 16 doses Nux vomica 0/1 and 16 doses Nux vomica 0/2. The patient was advised to take 1 dose daily early morning on empty stomach as per the Hahnemannian principle, like 10 downward succussion from ear lips to the umbilicus. After that, take 1 cap in half cup of aqua distilled water, take 2 spoons or 1 spoon, and the rest of the medicine to be discarded. In addition, she was advised for to follow a balanced diet plan and to avoid fast foods and processed foods during this course. So this is the timeline of the therapeutical interventions. As I said, on baseline visit, the first prescription, she was advised Nux vomica 1 and Nux vomica 0/2. So she was advised to come after 1 month. After 1 month, when she came on 8th August 2023, her complaint was that the pain in the right hypochondriac region increases in the first 2 days. Intensity, like after 2 days, it was gradually decreasing. Significantly, BP also reduced from 164/88 to 136/86. Her diet she followed strictly. So Nux vomica 0/3 I prescribed, and I also advised that ongoing medicine antihypertensives to be taken on alternate days. Next, she reported on 22nd August 2023. She had the mild pain only twice, very low intensity, BP 126/82, diet properly maintained. So Nux vomica 0/4 and Nux vomica 0/5 were advised. On 26th 9th 2023, again she came for third follow-up. So at that time there was no pain. BP was absolutely 122/80 mmHg. So what I did, I advised her to do another USG. And Nax Vomica 0/6 I prescribed, and I also advised him to take antihypertensives twice weekly. On 70, and ultimately on 17/10/2023, when she appeared to the OPD with the USG report done on 13 September 2023, no gallbladder polyp was there. BP was 122/84. So I gave her placebo, and antihypertensives were advised to be discontinued, and I told her to come to continue the follow-up. So as the clinical assessment I have done using the modified Naranjo criteria for homeopathy to establish a clear relationship between the clinical outcome to homeopathic intervention. And the PACES assessment, it is generally done by the USG report before and after the treatment as photographic clinical evidence. Here is the modified Naranjo criteria. Here the questions are there, and on the scoring I have found that the total score was 0/08 on a scale of 6 to 13. USG report, this is the before intervention, 17 July 2023. It is clearly showing highlighted one multiple gallbladder polyp, and the date was 17/6/2023. USG report after intervention, that is 13 September 2023. There it was clearly showing normal study. So I'm going for a comparison. Here is the USG report before, and here is the BSG report after. It is clearly stating the highlighted ones. This has been done by me, and the hand there is showing my hand. So previous report on 17 July, it was multiple gallbladder polyp, and on 13 September 2023, clearly showing normal study. These are the prescriptions. Visit number 1, visit number 2, visit 3, visit 4, subsequent prescriptions of the NIH, of our esteemed institute, National Institute of Homeopathy. This is the prescriptions. So discussion, the 24-year IT professional who was presented with occasional cutting pain in the right hypochondriac region was previously diagnosed with multiple gallbladder polyps, largest one 3.7 mm. She was under treatment at NIH for approximately 3.5 years. Initially, first couple of days, she was a transient aggravation of the pain. However, the pain reduced. One thing really to mention here, that the patient really is admirable one, that the patient, whatever I have advised her to take proper diet, avoid unhygienic and processed food, she had done that with intense attention. And so, and as a result, the follow-up USG at 3 months revealed complete disappearance of the gallbladder polyps. And additionally, her coexisting isolated systemic systolic hypertension normalized during this treatment. All the subjective symptoms as well as objective symptoms reduced. The MONARCH score was 0/8 in a scale of 6 to 13, which supports a highly likelihood that the observed improvements can be attributed to homeopathic treatment. So conclusion, as Master Samuel Hahnemann has said in aphorism number 2, the case was treated aimed at rapid, gentle, permanent restoration of the health, addressing the disease in its totality. Hello. So this was the case, and it has been published. It has been published there in a paper, International Journal of Ayush Case Reports. You can see IGRH in the September volume number 9. Thank you. Oh, so the conclusion page is here again. As Master Samuel Hahnemann, sorry, there was a technical glitch, I think. That's why it went away. Sorry, there was a technical glitch, probably. So, as the conclusion part is that Master Samuel Hahnemann in aphorism 2, like has said, the highest ideal of the rapid cure is rapid, gentle, and permanent restoration of the health. So, the treatment aimed at rapid, gentle, and permanent restoration of the health, addressing the disease in its totality. The initial aggravation of the pain aligns with Dr. James Schuyler-Tenn's third observation. The aggravation is quick, short, and strong with rapid improvement of the patient. As per the JT Kent's teachings, the remedy acted from within and outward and in reverse order of their systemic symptom appearance, leading not only to the resolution of the gallbladder polyps, but also to the normalization of the blood pressure. So, this case explored the possibility and the scope of homeopathy in gallbladder polyp. The cost effectiveness and the absence of side effects reveal the pragmatic advantages. Here is the publication of this case. You can all check in the International Journal of Ayush Case Reports, volume number 9, 0/3, July-September, International Journal of Ayush Report. Date of publication is 16 September 2025. The detailed case, here is the abstract of this image beside, and citation is given with proper links. These are my bibliography. Thank you very much, and thank you once again to Dr. Pralay Sharma sir, Dr. Vidyut Mukherjee sir, and Dr. Dev Narayan Kalyani sir for providing me the opportunity to present my case here. Thank you. Over to the moderator. Thank you so much.
Thank you, Dr. Soumyanath Mallik. That was really an insightful discussion, a case of gallbladder polyp. As we all know that homeopathy do have a really great role in treating surgical cases, and we can help patient prevent surgery, and can homeopathy alone can do this. So that was really a great discussion. Thank you so much. So our next speaker is Dr. Sonali Priya, 29th batch UG from NIH. Hello, welcome, Dr. Sonali.
Good evening, everyone. Good evening to all the viewers. Respected Dr. Priya Sharma sir, Director NIH Kolkata, Dr. Vidyut Mukherjee sir, General Secretary NIH Alumni Association, for providing me opportunity to present my clinical case in 125th CME Clinical Case Conclave. I am Dr. Sonali Priya, alumnus of NIH Kolkata, 29th batch, BHMS, currently pursuing MD Materia Medica from Mahesh Bhattacharya Homeopathic Medical College and Hospital, Howrah, West Bengal. Today I am here to present a clinical case on the topic chronic eczematous dermatitis and its homeopathic management. Definition: eczema, also called as dermatitis, is a reaction pattern of the skin with variable clinical histologic findings. It is not a single disease, but a group of conditions that lead to similar manifestation of inflammation, itch, redness, scaling, sometimes vesiculation. Histology and the hallmark of the disease is the spongiosis. As you can see in the picture, it is the intracellular edema of the epidermis. Here in the below the picture, it is showing that fluid is pushing apart squamous cells. Fluid can accumulate in the small blisters called microvesicles. There are multifactorial etiology, that is the genetics, immune dysregulation, barrier dysfunction, environmental triggers. Common triggers which can affect chronic eczema are the soaps, use of detergents, excess amount of detergents, friction, heat, sweat, allergen, microbes. What are the types? According to Harrison, there are different types of eczema or dermatitis. For example, ectopic dermatitis. It is the chronic inflammation of the skin, often start in the childhood. Contact dermatitis. It is allergic or irritant. Seborrheic dermatitis. It generally occurs in scalp, face, and upper trunk. Other eczematous disorders are also there. That are dyshydrotic stasis dermatitis. Typical clinical feature, there will be pruritus, that is itching, erythema, scaling, crusting. The lesion morphology will be macules, papule, vesicles, plaques, and lichenification. And what will be the distribution pattern? It will be distributed in the flexural areas, face, neck, wrist, groin, and aggravating factor is heat, friction, soap, stress, infection. Here you can see the affected distribution area. What is the diagnosis and investigation? It is basically diagnosed clinically based on the history and the lesion morphology. And in the histology, we can see spongiosis. Differential diagnosis can be psoriasis, fungal infections, seborrheic or contact dermatitis. Investigation, we can do KOH scraping, patch test, skin biopsy, or if uncertain. What are the prognosis and complications? It is chronic and relapsing remitting course. Complications are secondary infections, pigment changes, thickening, sleep disturbance, and psychological impact. Now I am presenting my case. This patient has came, name Mrs. XYZ, sex is, age is 31 years, female. She was a BD maker. She presented in the Mahesh Bhattacharya Homeopathic Medical College and Hospital on 13 November 2024. She has a complaint of scaly skin eruption on face for last 2 years, associated with burning, redness, and itching. Similar eruptions were also present beneath the left breast and on both sides of the groin. History of present illness was complaint started gradually 2 years back. Aggravating factors are after bathing and during night. She has applied very local application ointment, and that gives temporary relief. This is the picture of the patient when she came to the OPD. There is no major illness reported in the past history. In family history, father was suffering from hypertension. Menstrual history was normal. Cycle was 28 plus minus 2 days, duration 2-3 days. Obstetrical history, gravida 4, parity 2, and 2 abortions. Physical general was appetite has decreased. She has a desire of salty fish and ice cream. Aversion was sweet and fried foods. Thirst was 2-3 liters per day. Times. It is thermal reaction. She was a hot patient, and sleep was sound. Perspiration was scanty, and urine and stool was regular and clear. Thermal reaction was hot. Mental general, she was not very expressive patient. So The patient was mild and anger is very less. In general examination, build was moderate, pulse, BP within normal limits, no systemic abnormality was detected. Local examination, on face, she has a scaly erythematous patches with mild exfoliation. Left breast and groins has similar lesion. Diagnosis was made chronic eczematous dermatitis based on the clinical presentation and history. Treatment was natramute 200 was given in 3 doses once daily for 3 days. Follow-up was advised. She was advised to avoid local ointments or steroids, maintain gentle cleansing and avoid harsh soap. Balanced diet and hydration was advised. Totality I have made. She was a hot patient, decreased appetite, desire for salty food and fish, aversion to sweets and fried food. She had a scanty perspiration. Burning and scaly eruption on face, groin, beneath breast was the present complaint. An aggravating factor was during bathing and at night. She was mild and reserved temperament. Miasmatic analysis. Symptoms: chronic scaly eruption on face, groin, under breast. Was dominant miasm is psora psychosis. Remark: psoric itching, psychotic tendency to thicken, scaly patches was present. Burning and redness with itching comes under psora, and functional disturbance and inflammatory character. Aggravation after bathing and at night is come under psora due to typical psoric. It is typical psoric modality. Desire for salt, it comes under psychosis. It has a marked psychotic constitution. Mild disposition, reserved nature, that comes under psora. Emotional sensitivity, reserved temperament. Scanty perspiration, that comes under psora. Functional deficiency, due to functional deficiency, hot patient comes under psora, and it is a characteristic thermality of psoric type. Repertorial analysis. These are the rubrics were chosen. Skin, chapter skin, eruption and scaly comes in the chapter skin, and remedy coverage was natramute, dermatitis, and lycopodium. Skin itching, night aggravation, chapter skin, remedy was sulfur, arsenic, natramute. Skin eruption phase, burning redness, chapter phase, remedy coverage. So after repertorial result was natramute, total marks was 10 by 10. It has a maximum coverage of generals and particulars. So what was the basis of the prescription? Dominant psychotic miasm, characteristic mental and physical generals of natramute, chronic scaly burning itching eruption with aggravation from bathing. Follow-up after 1 month. Patient feedback was marked improvement in the facial eruption, dryness and scaling considerably reduced, itching and burning sensation much less, especially at night. No new eruption appeared on face, breast, or groin region. Sleep and appetite was improved. Mind, she was feeling more calmer and more energetic. So this is the picture of the patient after treatment, 1 month treatment. So you can see there is no scaly eruption. She was suffering from 2 years, for 2 years. So on examination, on follow-up, facial skin appears smoother, mild post-inflammatory pigmentation remains, no active oozing or redness, groin and inflammatory areas healing well, general health improved. Assessment was done, disease was under control, functional improvement noted both physically and mentally, no suppression or aggravation observed. So this was my plan of treatment after first follow-up. Continue with the placebo once daily for 15 days. No repetition of natramute at this stage. Wait and watch. Continue avoiding local ointments and irritants. Follow up after 4 weeks or earlier if any relapse occurs. So, conclusion, this case of chronic eczematous dermatitis was managed successfully through a constitutional homeopathic approach. The prescription of Natromute 200 was based on the totality of the symptoms, both mental and physical generals, along with the dominant pseudopsychotic mild. Following treatment, the patient showed marked improvement in the skin eruption, reduction in the itching, burning, and scaling, as well as enhanced general well-being and mental calmness. No new eruption appeared, and the existing lesion healed without any suppressive measures such as topical ointments. This case highlights that the importance of individualization and miasmatic understanding in the successful management of chronic skin disease through homeopathy. With proper case taking, remedy selection, and patient follow-up, deep and lasting cure can be achieved holistically, addressing both the internal and external manifestation of the disease. These are the references. Thank you.
So thank you. Thank you so much, Dr. Sonali Priya, for such a nice result you have shown in dermatological case. So next we have Dr. Pragya Garg.
Good evening, everyone. Hello, am I audible? Okay. Good evening, everyone present here. First of all, I would like to pay my respect to Master Hahnemann. And I'm extremely grateful and humbled to share this platform with the wonderful speaker and the director and my teacher, Dr. Pralay Sharma sir. And I extend my gratitude to NIH Alumni Association and Dr. Vidyut Mukherjee sir for providing us this platform. Moving on to my case. I have a case report on hyperprolactinemia and its complications managed by individualized homeopathic treatment. So moving further, we have an overview of introduction, patient's case taking, investigation, diagnosis, totality, selection of the remedy, follow-ups, and conclusion. So first of all, introduction, as the name suggests, hyperprolactinemia is a condition where the blood contains abnormally high levels of hormone prolactin. Prolactin, as you all know, is produced by the pituitary gland and is best known for its role in enabling women to produce breast milk. Now, there are many causes. For hyperprolactinemia, which can be physiological as well as pathological. First, let's discuss the physiological causes in pregnancy, in lactation, in stress, in exercise, and in improper sleep. The prolactin level increases, and some pathological causes includes prolactinoma, which is the most common cause, acromegaly, Cushing disease, macroadenoma, and paracellular masses. Now, before moving further, I would like to discuss some of the symptoms of hyperprolactinemia. So they differ from men and women, but general symptoms include decreased sexual desire, headache in some cases, visual changes, and galactoria. It may include irregular menstrual cycle like oligomenorrhea, amenorrhea, and in men, it projects as gynecomastia and erectile dysfunction. High prolactin can also lead to bone loss and fatigue. So the case I have today is a female, 33-year-old female, that she came to my OPD with the complaints of violent left-sided headache, burning in eyes, lacrimation, vertigo, and nausea, which was aggravated by light and talking and ameliorated by tight bandage. The history shows the duration of 3 months. She was taking analgesics and the temporary relief was temporary. Then coming on to the second complaint, she had mastitis, which on aggravation was on jarring, and she cannot wear tight clothing. There was no amelioration for this. For this, the history was the patient had galactoria 1 year ago, and she took homeopathy treatment. The galactoria stopped, but mastitis remained. The third complaint was her menstrual irregularities. She had oligomenorrhea, delayed menses, and from past 6 months, the menstrual flow was declining. And for this, she was consulting any allopathy doctor when she came to me. So the past history included galactoria in 2024. She took homeopathy treatment and got cured. History of COVID in 2021 and history of chickenpox in childhood. The family history included paternal side. The father has a history of depression. Maternal side, mother died of uterine cancer 3 years ago, and all her 3 maternal aunts were suffering from cancer. And own side, she had no history as such. The personal history includes she was a homemaker, mother of 1 child, married for 5 years. But here I would like to add one thing, that when I was taking her personal history, she told that she was not able to breastfeed her child after more than 2 months, because after 2 months her milk started to diminish. So and after 3 years galactoria happened. So and the delivery was normal vaginal delivery. The one point she mentioned was her decreased sexual desire from past 3 months. She was taking no medicine right now. So on generalities, her appetite was decreased. Thirst were normal, 2 to 3 liters of water. Maybe I have taken the case in May or June. So her desire was of cold and sweet drinks. There was no aversion. One thing she mentioned in stool, that she was always a constipated person since childhood. Her sleep was increased. Her thermal reaction was hot, and menstrual history, so we have already discussed before. Coming upon the mental generals, she had a weeping disposition with palpitations. According to her, every problem started after her mother's demise. After her mother's demise, all the responsibilities came upon this patient of her own family and her in-laws family. So she's a kind of patient that wants everything to be perfect, everyone to be happy, and everything to be neat and tidy. So coming on to the diagnosis, the patient presented with violent left-sided headache with nausea, menstrual irregularities, decreased sexual desire, and pain in both the breast for prolonged duration, which has not been resolved following standard allopathy treatment. She also has a history of galactoria. All these facts suggested a diagnosis of prolactinemia. So this was my provisional diagnosis, but the patient got 2 blood reports of serum prolactin from the previous treatment. And I suggested a CECT head and visual acuity test to rule out any prolactinoma, which is the most common cause for hyperprolactinemia. So final diagnosis was hyperprolactinemia. E22.1 is the ICD code for it. So these are the reports of the earlier treatments. She was going through allopathy treatment for more than 3 months, but the levels were keep on arising. Here it was 54.75, and even after taking medicine, the 2 months, it was 73 point something. And this is a report of CECT head, which shows no significant abnormality. So my homeopathic analysis of the case was performed using meticulous case taking. Symptoms were evaluated following Kantian method of evaluation, which considered mental generals of the highest importance, followed by characteristic physical generals and particulars. Now, due to the crunch of time, I evaluated with totality only. So she had weeping disposition, decreased appetite, prolonged constipation, hard stool with great straining, decreased sexual desire, increased sleep, pain in both the breast with the history of galactoria, violent sick headache with nausea, vertigo, burning in eyes, lacrimation, aggravation and amelioration, as I told earlier, menstrual irregularities, and a family history of cancer and depression, which primarily belongs to the miasm psychosis. So my therapeutic intervention was, the first prescription was Lec defloratum 200 BD into 4 days to be taken empty stomach, and I suggested her to take proper diet, proper exercise, and to meditate a little. So as the case had PQRS symptom, I didn't report PQRS symptoms in the totality, so there was no need for repertorization. And 200% potency was chosen on the basis of patient susceptibility and nature of disease and medicine. So coming for the reference of the medicine selection, I chose the Materia Medica of Nosodes by Dr. H.C. Allen, where it's clearly showing that menses which are naturally scanty and postponed, and a complete elaborated description of the headache. I have also taken consideration of Allen keynotes and J.H. Clark of Practical Materia Medica. I have highlighted the points which I took into the consideration. So the results were, at baseline, the patient was prescribed single remedy Lec Def 200 on the basis of totality of symptom. The improvement of the case was steady and continuous following the first prescription. The medicine was repeated at different time points as suggested by existing symptom complex. So I also gave carcinosin 1M 1 dose as an intercurrent remedy, which I'll be explaining in the follow-up section. The total duration of the treatment was approximately 3 months, resulting in complete resolution of all the presenting complaints, which is supported by the serum prolactin test report. The case is being kept under observation till today, during which none of the symptoms reoccurred. So here is a follow-up list. In the first follow-up, the headache and the headache frequency decreased. Like she had the bout of headache per day, 3 to 4 bouts, and every day she was having headache. So the frequency decreased to 3 to 4 times a week. The vertigo was completely resolved. The nausea and throbbing with headache was slightly better, but the pain in breast was as before. So I repeated the medicine. Then on the second follow-up, the headache was better, nausea and throbbing in head was better, the pain in breast was slightly better. So I placebo for 15 days. Then in the third visit, when the patient came, she was slight unsatisfied, saying that the complaints were ameliorated much better in the first and second visit, and now they are almost more or less the same. So I thought my case has come to a standstill condition. So I prescribed carcinosin 1M 1 dose, providing that her history of prominent cancer in the family and sudden responsibilities on her, and her mental journal of keeping everything perfect, I prescribed an intercurrent remedy of carcinosin 1M 1 dose. Then again on the fourth visit, the headache with nausea, throbbing improved. Mastitis were much better this time. Sleep was improved. For the first time, she discussed about her generalities. Sleep was improved, and menses was on time, and the flow was also improved. So I gave her placebo for 15 days. Then on the next visit, headache was better. As said by the patient, it's almost 90% improved. Mastitis was improved. Sexual desire slightly increased according to the patient, but she complained of lower back pain, which on asking again, she told that once she had an injury a few years back, that time she had a lower back pain, so that again appeared. So considering that all symptoms reappeared, I again repeated the medicine for 2 days, and placebo was given again for 15 days. Then in the next visit, overall complaints of headache, mastitis, back pain were resolved, and generalities were improved. So here I advised a serum prolactin test and gave her a placebo for 15 days. Then coming on the final visit, she came with all her complaints resolved, and the serum prolactin reports came to be normal, which I have attached below. The patient feels completely satisfied and better. As you can see the report, it was an earlier report, and it is now, it's completely resolved. And This was the final visit of the patient. So the conclusion is the incidence of hyperprolactinemia and its associated complications is significantly rising today, driven by modern lifestyles such as sedentary habit, chronic stress, and poor sleep hygiene. Conventional medical treatment, which my patient had pursued for 3 continuous months, offered only limited success, with symptoms persisting. This necessitated an alternative therapeutic approach. This case successfully highlights a complete cure achieved solely through individualized homeopathic treatment. The positive clinical outcomes evident in this case strongly underscore the potential efficacy of homeopathy in managing this condition. Thank you everyone for listening to me patiently, and thank you everyone for providing me this platform.
Thank you, Dr. Pragya. That was a really nice discussion. So, our next alumni is Dr. Rajbala.
Good evening, everyone. I am audible.
Yes, you're audible. You're audible, Dee. You can continue.
Good evening, everyone. Good evening, everyone, esteemed members of NIH. Today, I am Dr. Rajbala, 29th batch PHMS from National Institute of Homeopathy, Kolkata, currently pursuing MD, second batch at NIH Delhi. To, I express my heartfelt gratitude to Master Hanneman. I am equally grateful to Dr. Pralay Sarma, Director NIH, and Dr. Bidit Mukherjee, sir, General Secretary, NIH Alumni Association, and Dr. Kalyani, sir, for giving me the opportunity to present my clinical case in this CME. Today, I will be presenting a case, an evidence-based case on the topic individualized homeopathic management of polycystic ovarian disease with right hemorrhagic ovarian cyst, an evidence-based case report. Aim of this presentation is to highlight how a well-selected individualized homeopathic remedy can bring significant results in such complex gynecological conditions. Before beginning the case, let me briefly introduce the condition we are dealing with. A hemorrhagic ovarian cyst is a functional cyst developed in the reproductive age woman formed when bleeding occurs into a follicular or corpus luteum, often presenting with acute pelvic pain and menstrual disturbances. In some cases, it may coexist with the polycystic ovarian pattern where multiple immature follicles reflect underlying hormonal imbalance. Now let's move with to the details of the case. Case summary. A 27-year-old female presented with complaints of pain in the right lower abdomen and scanty menstrual bleeding for the past 5 months. She also reported a peculiar sensation of something alive moving in the abdomen. Her case was marked by a history of emotional grief, and involuntary sighing was observed during the consultation. Based on the totality of symptoms, Iglesia Mara was prescribed. These are the totality of symptoms in which mental general includes involuntary sighing. The patient is often seen sighing unconsciously, which indicates inner emotional grief. History of grief from emotional disappointment in relationship with her husband, as her husband was involved with another woman. She likes company. She also has disappointment of love. In physical general, it includes right-sided complaints as the right-sided of ovaries affected. There is scanty menses also. In particular symptoms, acute sense of smell. The patient has high sensitivity to odors, and a peculiar characteristic symptom patient said that something is moving in her abdomen. As the general symptoms are more marked, I selected Kent repertory using Homepath Firefly software. The main rubrics considered were sign, grief, company desire for, love ailments from disappointed, generalities, right-sided, genitalia, female scanty, nose smell acute, abdomen alive sensation of something, genitalia, tumors, ovarian cyst. Based on the analysis, Ignitia covers maximum number of rubrics with maximum marks. After confirming with Naturia Medica, Ignitia 200 was given. Here is the progression of the case. On 13th November, patient came with USG done on 11th November 2024, revealed right ovarian hemorrhagic cyst measuring 46 into 36 mm with PCOD. Ignitia 202 dose with placebo for 4 weeks was given. On 20 December 2024, after 1 month, patient came. There was an improvement in menstrual flow, which indicate a positive reaction to initial prescription. Hence, placebo was continued for another 4 weeks to allow the complete action of medicine. On 22 January 2025, there was marked physical changes and there was no marked physical changes, but mental symptoms still prominent. Considering this, the potency was raised to Ignitia 1M single dose followed by placebo for 4 weeks. On 27 February 2025, when patient came with ultrasonography, shows no evidence of hemorrhagic cyst and PCOD with normal menstrual cycle with marked improvement in mental sphere. There was no involuntary sign also noticed. Here are the result on 11th November when patient came with ultrasound. There is a size of 46 into 36 ovarian cyst, sign of hemorrhagic cyst with polycystic pattern in bilateral ovaries. And after treatment, there was no evidence of any hemorrhagic cyst and PCOD changes. This improvement clearly demonstrates the curative response under the simillimum ignitia. The conclusion, the right ovarian hemorrhagic cyst 46 into 36 millimeter resolved completely within 3 months with Ignitia 1M as confirmed by ultrasonography. There was also a significant regression of the polycystic ovarian pattern with restoration of regular menstrual cycles achieved through individualized homeopathic treatment without any hormonal or surgical intervention. Thank you. Thank you everyone for giving me this opportunity or this platform. Thank you.
Thank you, Dr. Rajbala. So our next alumni is Dr. Shubhrokanti Datta.
Subhrakanti sir will join at the last. Just continue with different, if possible.
Who next then?
Uh, Subhrakanti sir will join later at the last, since due to some technical difficulties. Subhrakanti sir will join later. Just try to move on to the next.
Okay. So, ma'am is there, Dr. Usha ma'am? Yeah. So we have our next speaker, Dr. Usha Uchat ma'am. Good evening, ma'am.
Good evening.
How are you, ma'am?
Fine.
Welcome.
Thank you. Thank you.
Ma'am, you can start, ma'am. Usha ma'am, you can start, ma'am.
Yeah. Just I'm trying to. uh,
Ma'am, if you're facing trouble,
Actually,
you can ask to another
slide.
specialist.
I'm not able to get the slide. Just I'm trying to find out.
Okay, okay,
Yeah.
okay, no problem, no problem. Take your time, ma'am. No problem.
હવે નથી થતું આ જોઈનિંગ પ્રેઝન્ટ મારું ક્લિનિકલ કેસ
પ્રોસેસિંગ થઈ રહ્યું છે ને.
Viewers, please hold on. We are trying to catch a moment. Ma'am is taking some time, and we will get back soon. Just hold on till then.
સ્ક્રીન વિઝિબલ છે કે નહીં?
Is the screen visible? Hello.
Yes, ma'am. Yes, ma'am. The screen is visible, ma'am.
Okay, thank you. So first of all,
Over to you,
I
ma'am. Over to you.
thank you. First of all, I would like to show my gratitude to our director, sir, Dr. Priya Sharma, my colleague and my batchmate, Dr. Vidyut Mukherjee, and who is the secretary of the National Institute of Homeopathy Alumni Association. I show my gratitude to Dr. D.N. Kalyani, sir, who told me to be present this CME. Now, my presentation is a bit different. Being the teacher of Homeopathic Methodika, I would like to. નથી દેખાતું દેખાતું સ્ક્રીનમાં નથી દેખાતું. So my today's focus is on the drug Calcaria austrium. So it being Hahnemann's great antisoric constitutional remedy par excellence, this I would like to highlight through one case. A girl aged 10 years complained of periodical pain in throat. It was right-sided mode, difficulty on swallowing, and this pain in the throat was aggravated whenever she used to take cold drinks or was exposed to cold wet weather or cold air. She gave history of recurrent tonsillitis with fever, headache since 3 years. And she had taken treatment symptomatic with temporary relief. Another complaint was thick white discharge before menses for 2 years. Her menarche was precocious. It started at 8 years age. History of illness, her mother said, আমার মেয়ে খুব ঘামে হয়তো ঘাম বসে যায়, সেই জন্যই ওর ঠান্ডা লেগে যায়। So she sweats profusely and easily and frequently suffers from fever, headache, cold, pain in throat, difficulty swallowing, and becomes delirious along with the lots of imagination. Past history, her milestone, there was a complicated dentition and she suffered from recurrent tonsillitis. In the family history, I found there was tuberculosis and diabetes mellitus. Among the genetics, I found there was desire for egg, sweets, chocolates, onion, fast food, ice cream, aversion to vegetables, milk, intolerance to milk, which causes sour eructation. So she avoided milk. Thirst was for cold drinks. In the urine, there was nothing contributory. Bowels, she had a irregular bowel habits. Usually the stools were hard, and there was colic pain before stool. Perspiration, there was profuse perspiration, sour odor, and it was all over the body from head to toe. It was cold. Menses were early, profuse, bright, and see, every time during menses she used to get exhausted. Dreams of ghost. General examination. This girl, she was 10 years old when she came, but she looked bigger, larger than her mother. She was fair, obese, taller for her age. General examination was done. There was paleness. She had a slight anemia, and her palm was very peculiar. It was cold and very soft, as if boneless, and sweaty. Mental symptoms, she was very intelligent but never actively participated in any activity in the school. She was very much affected by any criticism or remark, and so, though interested, could not play in any sports or participate in extracurricular activities organized by the school. There were lots of imaginary fear and apprehension, as if others will laugh on her if she could not do well. On examination of the throat, the tonsils were swollen, slight congested, right side was more than left, lymph glands around the neck were palpable. So the prescription, as I said, I am going to highlight Calcarea ostrium. I started with 0-1 twice daily for 8 days. Patient was feeling better. So the next potency was 0-2, followed by 0-3, followed by 0-4. And about after 1.5 months, when the patient reported her periods were improving, the medicine was prescribed in centesimal scale. And last potency which was given was Calcarea ostrium 10M. This patient was actually a relative of one of our contractual staff, and her mother was under my treatment. She used to come regularly. So she said she's doing well. About 4 years later, when the patient came, I was really, what to say, I was to see her that she had become very much slim, and she was learning dance and performing stage show. She was doing stage show. So this was my eye opener for me, that I learned that Calcarea carb, as when I was a student or when I become teacher, I used to think that Hahnemann says it is a very great antisodic remedy, uh, and it is very useful remedy. It is a constitutional remedy. So from here I understood that our medicine can even change the constitution, both physical and mental. uh, and this I had learned from other cases also. In the beginning of my profession, my as a teacher, one patient came, very young adult, and he came with the pain in the back, in the lumbar region, and he had come with diagnosis as renal stone, both side, and he had pain in the lumbar region, and he had taken medicine, but there were no other symptoms like nausea, vomiting, or urine getting obstructed like that, but there were multiple stone in both the side of the kidney. So, and the patient was constitution just very much what we learn in calcarea carb, as the patient is obese, fat, and the desire, aversions, all were matching with calcarea carb. But I was not sure whether calcarea carb is useful in renal stone. So I I had one Boric Mathematica. I just gone through the renal this calcarea carb chapter and found in the back it was given renal colic. So I prescribed the medicine, and I was very much satisfied when the patient came in the next visit with small stones in his hand and showing the stone has come out. So another case of osteoarthritis, one lady, she came with pain in the knee joint, right side more than left, and her constitution, her symptoms, there was acute pain on walking, there was a swelling also in the knee joint, right side more than left, but patient's symptoms constitution like calcarea carb. But when the because the pain was very much acute, and the symptoms were like Rustux, so I gave her Rustux. And in the next visit when the patient came, again the calcarea carb was given in seasonal potency, and this lady, she had so much relief of the pain that she went to Simla to visit Simla, and she had a very nice time. When she returned back, she came again to our OPD, and she complained of the pain in the knee joint and swelling. And she said, "Your medicine had worked well. I had visited Simla." So this showed that Rustux and calcarea carb are very useful medicine. And guaiacum also in one case, the patient had come, but this guaiacum patient, when the patient came, there was means no relief from heat or cold with no symptom. And I had learned from my teacher guaiacum very useful remedy for acute inflammatory condition of joints, only better by external pressure. So this and after guaiacum, again the constitutional medicine calcarea carb worked very well. In another case of PMS, because this lady came with, she was actually hypothyroid, she was suffering from hypothyroidism, and she was under eltroxin 50 for 2 years. And this lady had a history of disappointment in her life, and she had the very important symptom of involuntary shying. On that basis, ignitia was prescribed. I had gone up to 10 but again I had to come back to this calcarea carb, because the constitution was just like calcarea carb, and after giving calcarea carb, her all the symptoms relieved. Another case of fibroid uterus, where the patient actually may be suffering from fibroid uterus, but there was an acute episode of she had a fear, because of some unusual happening in the house, in her home, and she was her menstruation was very much profuse, and she couldn't that lady came with profuse menstruation, menorrhagia, and it was not stopping. She had taken allopathic medicine also. So only on history of fear, fright, I gave her aconite straight away 10 mg. The period stopped, means the menstruation stopped. But again in the next month, again it was profuse. Then sulfur was given, and after sulfur gave some relief. But again the calcareostrium gave the complete relief. And when the next, I think after 6 months, when the report was done, the fibroid, the size of the fibroid in the uterus was small. So these cases I have tried to show you that how the calcarea carb is one of the greatest monument of Hahnemann's genius remedy, as mentioned in the books of homeopathic mathematica. So this is my presentation. Thank you.
Thank you so much, ma'am. It is always great to learn from you. There is always something new to learn from you. So thank you so much for highlighting about calcarea carb once again. So next, now we have Dr. Shubhrokanti. Yeah. So our next speaker is Dr. Shubhrokanti Datta.
You have to wait D because I hope if you just bring up Dr. Kalyani sir for moderation of this because we are trying to get connected with Parthapratim sir and also about Subhrakanti basically from my side it's the difficulty I am facing some difficulties since I am going home. So after reaching home, I will just share his screen. I mean, share his PPT, and then from then we can just continue with his part. So that's why
Okay, sir.
just ask Dr. Kalyani to just moderate those who have just completed till now. Just ask them
Yeah.
if possible.
Okay, if you can just add him. So, Dr. Kalyani sir, so we have two more speakers left, but there is some technical issue actually. So till then, if you can moderate for already discussed case.
Sure. Thank you, Dr. Siddiqui. This I was stating in the beginning that the constraint in the growth of homeopathy is a persistent thing since inception of homeopathy. Just remember the history of homeopathy. Since the day of invention of Cinquana officinalis till today, we are facing various type of constraints as we are facing today by internet. But no constraint, no obstruction could arrest our growth. We have grown gradually in spite of hundreds of difficulties and we will grow on. Today's CME is a remarkable CME, to me at least, because seldom we find that in a CME, director is present, means director of National Institute of Homeopathy is present, former deputy director, HOD and professor of Mathematica, Professor Uchat is present to inspire of us, juniors are present. So it is a combined effort that persons of any status, persons of any knowledge, from junior to senior, all of us are one. We want to be inspired. We want to increase our confidence to others. There are various types of increasing confidence, but seeing the cases are getting cured by self or by others, what is my experience, that is the greatest confidence we get, and we become more proud that yes, as per today's CME is concerned, we can cure gallbladder polyp, we can cure PCOD, even hemorrhagic cyst, we can cure eczema, we can cure your prolactinemia, and as Professor Usha showed us, calcary carb. I am very much thankful to Usha because she responded to my request. I asked him to inspire all of us by presenting his appearance. He appeared in number of cases and gave us fantastic confidence in calcary carb by showing that not only homeopathy can cure, homeopathy can change the entire constitution. A lady of quality, quantity without quality of calcary carb turn back to quality without quantity. Can anybody imagine? Is there any therapeutic system in the world which can do this? That quantity without quality, calcary carb, turn back within few years to exactly reverse quality without quantity. Just imagine this calcary osteotum, calcary carb, worked where and where not, starting from the hormone, metabolism, digestion, desire of taking things, entire body mechanism, entire body physiology was gradually changed to be normal. This is homeopathy. This is our confidence. This is our proud that yes, we can do this. These one cases does not mean one cases. These 1-1 cases mean sample cases. Once we go to the grocer shop or any other shop, we ask the shopkeeper, can you show me the sample by which I will be confident regarding the contents or materials or number of things? So that shopkeeper used to show us one sample, and we are very sure that we'll get many things. Similarly, as we found the samples of cyst, polyp, eczema, structural absolute change, uterine tumor, uterine fibroid, many other cases as we heard today. Yes, we can change it. One case does not mean one case. One case means one sample. One case means our 100 times confidence that yes, we can do this. We can cure uterine fibroid. No need of any operation to charge. No surgical or no surgeon charge. No medical interference by toxic drugs. So without any operation, without any instrumental interference, simply few drops or few globules can completely cure critical cases, as Professor Usha showed us. I can remember one incident that in our early life, in our student life, we were intended, especially me, were intended to see number of cases in one's chamber, one teacher's chamber. His reply was no, don't go. If we go there, you will try to be a copy of your teacher, which is not wanted by homeopathy. Homeopathy wants individualistic approach. So homeopathy wants much more from you than your teacher, because system wants to grow. Do not simply confined by the experience of your teacher only. So what is necessary? You see the cases are cured by the teachers in your institution. Get inspired that yes, this type of diseases can be cured by homeopathy. Study literature, strive on the case, do the all needful measures for curing the cases of selection of drug. You yourself will develop the confidence by curing your own cases, by seeing success of other cases. It is definitely inspiring. But if you can cure your cases, that is 100 times more confidence and inspiration you get. That is to be done more seriously, sincerely, than to see others. We tried to follow it and we got fantastic result. Confidence definitely have increased. One more thing I want to tell you, that as we are talking about the constraints, we are facing different types of criticism through and through. Since time of Hahnemann till date, I will tell you one incident that few years back in Delhi, Pragati Maidan, there was one Arogya Mela, and that Mela was organized by Minister of Health and Family Welfare, not by Ayush only, Minister of Health and Family Welfare from Nirman Bhavan, and all the system of therapeutics used to attend the Mela by showing their successes, presenting their inner materials to show the peoples, common people, to inspire them that these are the systems available in the country, you can use any of it. Their scopes and limitations. So in that Arogya Mala, in the inaugural speech, I told once day, why I am repeating this will inspire all of you. In the Arogya Mela, in the first day, in the inaugural speech by the Union Minister, Dr. Ambubani Ramadas, he was an allopathy doctor. He told during his speech that I have gone through one journal, international famous journal, probably in Nature, that famous scientist of the world is criticizing homeopathy. I am requesting them to come to India by our cost, by free of cost from them. We will bear the cost. Come to India, see what is homeopathy and change your views. So promptly, so proudly and so confidently he declared that please come, we will pay the cost. Now that version is, we can repark it. We can ask to the people, to any criticizer from any corner of the world, if you find ever anybody is criticizing, Simply ask him to come to a night. Come once in a night. See the OPD and hospital and the records cured before and change your views. Obviously, criticism has given us inspiration, but we should not care about the criticism, because simple reason, huge number of cases has been cured in OPD by number of doctors. Day by day, the number of cures are getting increased. That's why patients are coming from far distance to our OPD. Students are coming from abroad. So system is increasing because people wants it. People has felt that homeopathy has got some area of treatment. Moreover, one more thing I want to tell you, that eventually I met one very top ranking officer of State Bank of India. He is telling to my daughters that, see, be serious regarding your system, homeopathy. Entire world is searching for alternative system of medicine because they have become scared and tired of taking conventional system of medicine for their side effects. The day will come when people will run to you for recovery. Because the more the days are advancing, more complication. If a patient is going for treatment of one disease, he is inviting few more diseases for treatment only. Homeopathy exactly reverse. Once patient come with us, with number of diseases, we can cure at a time, as you have seen in the first case. Blood pressure was not the target. Polyp was the target. It was cured. In all cases, you will see, if uterine fibroid is the target, we are not only treating the uterine fibroid, we are treating the patient. That fibroid is getting cured. All other complaints will be gradually improved and cured. That means degradation of all the complaints by one concept, by single drug, is possible only by homeopathy. That means the more you will be stick to homeopathy, more taking or intake of drugs will come down, more you will be free from the complaints, including inherited or hereditary diseases. So that's why always we must be very strict to this thing of today's CME. Whenever you feel, whenever you see or experience or find a cured case, please come forward, present in the CME. Let the other alumni and students and the homeopathic professionals at large see that yes, homeopathy can cure. One case means hundreds of inspiration that we have achieved today, and we're inviting all of us to come forward, even by one case. That is not less. So many thanks for all of you to come. Those who are on screen or out of screen, there are some constraints. We are trying to bring them on the screen. But this attitude of showing successes to others, not only it will feel my proud, not only it will increase my confidence, but it will provide confidence of the whole fraternity, whole profession, all the friends, brothers, sisters, all the homeopaths of the world, and will grow and grow and grow by this way only. Thank you very much. Let us wait whether they are ready or not. If they are not ready, I will tell you few cases. Orko, are the speakers are ready?
Thank you so much, sir.
Sorry to come in between. Basically, I don't know if I'm audible or not. So,
Yeah.
since there are some technical issues from Subroda's side and also from my side, so that's why I think we can do one thing. We will just change to on 127 CME. It will be best for us to just do one individual semi and we will see that. For now, you just conclude if possible. So that's the best thing to do right now. Okay, do. And just conclude it and no more other speakers for now.
Okay, okay, sure. Okay. So yeah, so it was our 125th CME, and uh, there were so many technical issues, so many other issues, but yes, we were able to successfully complete it. And once again, I would apologize to all of your viewers on the behalf of our alumni association for all the inconvenience all through this live CME session. And congratulations once again to all the team of our alumni association for making this successful 125th CME. It is due to all the tireless efforts of the team we have reached this milestone today, and I'm sure that we are going to achieve so many more milestone in the future. So yeah, we had our inaugurator, our secretary sir, our moderator, our director sir of NIH, but unfortunately we couldn't add them here, but that's not a big issue. We will definitely hear them in our upcoming CME. So I thank you all for joining. I thank you, Dr. Devnaran Kalyani sir and Dr. Arka Mukherjee. So I think we will conclude today's CME and all our speakers. Thank you so much once again to all our speakers for presenting such wonderful cases, for sharing your successful stories. And I'm sure this has definitely inspired all our viewers and make the belief of all the other lay persons firm in homeopathy. So thank you each and everyone. And thank you to Dr. Vidyut Mukherjee sir, Dr. Arka. In spite of all the hurdles, we were able to complete this CME. So with your permission, sir, could we just conclude, or Dr.
Sure.
Yeah.
Please conclude. Please.
Okay.
Thank you, all of
So
you.
thank you. Yes.
Thank you. Good night to all of you.
Thank
We'll
you so
again
much,
meet.
everyone, for joining.
Sure.
We'll meet in next CME. So yeah. Thank you. Good night.
We'll meet again.
Yes, sir.
Thank you. Thank you. Good night.
Okay.
Thank you all. Thanks for watching. I hope you have enjoyed today's video. And yes, I am currently running right now. So without wasting any more time, it's time to say good night to you all and see you in our next CME. Until then, it's me, Alpha Mukherjee. Peace out.